Welcome to this morning's edition of Business Talk, where ABC5 takes a deeper look at local businesses and services. Today, we are here with neurologist Dr. Safwan Alboiny. Dr. Alboiny, what is epilepsy?
Epilepsy could be hereditary or could be related to different reasons like head trauma, like birth injuries, and toxic materials. Seizures could be caused by epilepsy or could be caused by different reasons. Some are drugs, some are alcohol. So unprovoked seizures are epilepsy. Yeah, that's what unprovoked. So means when it's unprovoked means that we are unable to find the reason why patients have seizures. So if we find a reason for seizures, for example, if somebody is drinking alcohol every day and then stops drinking alcohol, he would have seizures, but these are withdrawal seizures. So these are not epilepsy. But seizures, and of course also if somebody is on drugs, if he's doing cocaine or amphetamines, they would have seizures, but these are provoked seizures. So epilepsy is unprovoked seizures. Unprovoked means that we don't know why the seizures happen. We try to find out, and how do we do that? We do the EEG, which is the electroencephalogram. It measures the brain activity. This EEG could be done for a short time, most likely 20 minutes to 1 hour, or could be done for days.
How do you diagnose epilepsy?
EEG would tell you where the seizure is coming from. If it's coming from the temporal lobe, if it's coming from the left side, right side, temporal lobe, frontal lobes. Then you do more studies. So after you have the EEG results, you do MRI for the brain, MRI of the brain, and then with the MRI, you may find some etiology, some let's say pathology in the brain that may explain seizures. A lot of times we don't find anything in the MRI of the brain. And what's important is when we do the EEG and then we do the MRI, if we find clear etiology or clear cause for seizures, then we can treat patients with medications, and if they don't respond to medications, then we send them for surgery. Okay, a lot of people have nerve problems, especially carpal tunnel, especially brachial plexopathies, injuries to the nerve in the neck, and or injury to the nerves in the back. We do EMG in the office here, which helps in diagnosing the extent of nerve injury and muscle injury, of course.
That's all for today's edition of Business Talk on ABC5.